core mission at the university is to maintain an environment where faculty can move therapy forward. In order to do that, we must have a laboratory like experimental surgery that maintains the equipment and the personnel in order to do that. Our relationship really can be described as one of collaboration. We collaborate with leading edge scientists such as Dr. Taylor in helping them with their new ideas and their new therapies for human health. And we do that here after they have proven that they have made some progress. We do that here to make sure that they're safe for the next stage. And the next stage is clinical research and the use in humans.
We're developing the newest treatments for heart disease, cell, gene, and molecular treatments. We're educating the next generation of scientists and doctors, making sure that they know about those new treatments and can provide them to patients throughout the world. And then service. It's all about giving back to the community. We have the privilege here at the university of participating in the community as well as in medicine and science.
The University of Minnesota's legacy of innovation in cardiac care began with the open heart surgeries of the 1950s. Today, researchers and students at the Center for Cardiovascular Repair research new treatments, train the next generation of scientists and physicians, and give back to the community through innovations in patient care.
We develop new therapies. We then move them forward with research in the laboratory until they're ready to move into clinical studies. The next generation scientists are getting to participate in those studies, both clinically and preclinically, and learn the future of medicine. One of the advantages of working in a university setting means that not only can we come up with new ideas, we can test them, we can develop them, and we can move them forward for use in patients.
Dr. Taylor and the center work closely with collaborators like the Experimental Surgical Services Lab to move new ideas toward clinical studies and better patient care. ESS is a comprehensive research facility where new technologies can be applied and tested for better patient treatments.
Translational research is bench to bedside. We take ideas generated at the bench, like Dr. Taylor and our use of stem cells. We evaluate them here in experimental surgery and get them to the patient as soon as possible. Our mission is to translate new treatments to the patient as quickly as we can. In addition, we use these collaborations to teach the next generation of scientists, to teach other physicians on these therapies prior to the use in humans. Once we have a therapy ready, everybody's ready. Experimental surgery here at the university continues the tradition of innovation. The innovation really started in the 50s when heart surgery and the pioneers in heart surgery were here working in the laboratory. This is the same laboratory that has been in operation ever since. It's a history that's important to continue. We must move the treatments forward, and we are. New therapies such as Dr. Taylor's are cutting edge. Experimental surgery is a collaborator in that.
Innovation is the common thread that ties these two researchers together. Their combined efforts are also designed to help educate a new generation of scientists and physicians.
Developing ideas in the laboratory is only the beginning. We have to move those ideas into patient care. That means working with individuals like Mr. Bianco at Experimental Surgical Services to define the safety and the efficacy of those treatments. That means making sure they're safe and effective for patients before we ever move into clinical trials. Science is never easy. New ideas are never straightforward. But it's important that we develop those new ideas because patients demand it, need it, deserve it. So what that means is we have to train doctors about what's involved in research, how it works, when it doesn't, what to do, and how to move it forward.
With visionary researchers and comprehensive labs, the University of Minnesota has all the tools in place to move its ideas from the lab bench to the patient bedside.
We're working in ways to treat atherosclerosis, or hardening of the arteries, to treat patients who've had a heart attack and actually begin to try to repair the damage in the injured heart, and ultimately to treat heart failure by developing new tissues and organs for transplantation. None of those ideas move forward quickly. But what that means is we have the opportunity to do studies both in the laboratory and in areas like experimental surgical services, where we move forward and ultimately can test therapies in clinically relevant settings. That means by the time we get to the patient, we know what's going to work, what's not going to work, and hopefully how safe and effective it's going to be. Cell therapy is the ultimate in personalized medicine. We're finding out that stem cells from men and women differ, that stem cells from old and young people differ, and that your cells may or may not be the best treatment for your heart disease. We're committed at the Center for Cardiovascular Repair to finding you the best treatment for your heart disease.
We have the resources here, we have the environment here, we have world-class scientists such as Dr. Taylor here, and so we can work together at early stages. And the sooner we work together, the sooner we collaborate, the sooner that we can get them to patients.
Through innovation and research, institutions like the University of Minnesota offer patients cutting-edge treatment.
One of our most exciting new areas of research is the development of organs from stem cells. Here at the center, we believe that we can develop a heart from your own stem cells, transplant that heart, and even potentially one day cure your heart disease. Patients call us daily, asking for the newest treatments, asking for the latest ideas, and asking what their opportunities are to be cured, treated, helped. It's a privilege to be able to do that, to provide that information. It's a privilege to participate in the community, and our opportunity to do so is only increasing.
We have been participants in the development of every heart valve really in use today. And we do that by working closely with industrial manufacturers and with bench scientists and biomedical engineers to develop new heart valves, to assess their safety and get them into the patients. We use the surgical procedures to train residents, to train other students and professors so that they can put the heart valve in once it gets into human research. So that's what we do very well here. And what we have done well here is the development of cardiac valves. My satisfaction comes from students primarily. And we have story after story of people that really didn't understand medicine, didn't like science, but we got a spark of interest here in medical research, and they went on to become practicing physicians and scientists and veterinarians, and that's what we really strive to do, is to train the next generation of scientists. Certainly with minimally invasive techniques and robotics, we need to be 5 years ahead of that. So we sort of have to see into the future as best we can to anticipate what the patients need, what the clinicians need, and to have that environment here, have those resources here at least 5 years in advance.
We want to develop the best treatments possible for heart disease. If it's a new idea, we want to try it, we want to make it work, we want to take it to patient care safely and effectively. The people in Minnesota deserve it, the people in the nation deserve it, patients worldwide deserve new treatments for heart disease. We want to create a cure.